Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's episode of the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty necessary to change your community from the inside out. This week is week 2 for us for our MS Awareness Month. So we're going to be going over another study on MS. As a reminder, your challenge this month, should you choose to accept it, is to take each of these studies referenced in our MS Awareness Month podcasts. Last week, we mentioned a study of 81 cases of MS and Parkinson's disease. Each week to take this information and to create a video online on Facebook about it. Just you and your practice talking about it. And start targeting and retargeting people based on that. You are to make 4 educational videos this month, coupled with 1 or 2 video patient testimonials of people with MS. Watch how the referrals, they've already begun to change for us. It's amazing to see people who say, you know what, I've been thinking about this. This makes a lot of sense for me. But now that you specifically mentioned this, I'm going to finally get this person into your office. We've already seen our referrals start to change with that, which is great. That's what drip education is all about. We're also doing, if you guys want to learn more about online funnels, there's a 30-day challenge from Russell Brunson's team over at ClickFunnels. You can join us there, getting and have some accountability for this process at chiroedgemedia.com/funnel. I hope you join us. If you are posting those videos, I've seen a couple of you guys start doing this so far. That's awesome. Go ahead and tag us in the comments. Don't do it in the main copy because you don't want that showing up for everyone to see. But tag us in the comments. We'd love to start sharing your stuff on our page, on the ChiroEdge page. So it's at ChiroEdge, and then what will show up is ChiroEdge-Dr. Anthony Pellegrino. So with that, I'm looking forward to jumping in with you guys. We're going to talk about upper cervical vertebral subluxation in multiple sclerosis patients with chronic cerebrospinal venous insufficiency, a pilot study. This is from the Journal of Upper Cervical Chiropractic Research, and they say that we are going to be investigating the relationship between atlas vertebra misalignments identified via radiographs, specifically upper cervical x-rays, and patients with multiple sclerosis and chronic cerebrospinal venous insufficiency. Some background information for you is that MS affects 400,000 individuals in the U.S., and 12,000 new cases are diagnosed every year. Quick math says that's 1,000 new cases diagnosed every month. What's important to know is that the number of diagnoses per year has increased over the past years, whether that's because of improved diagnostic capabilities, increased awareness, or more people being diagnosed. We don't know, but all we know is that there is more people being diagnosed. It affects 2 times as many women as men, so it follows the unexplained bias of autoimmune disorders. It's largely considered autoimmune with multiple factors playing a role. But recently, chronic cerebrospinal venous insufficiency, that's chronic cerebrospinal venous insufficiency, or if you look it up, it's CCVI, has been found to be a contributor to MS. This is an anomaly of the main extracranial cerebrospinal venous roots that interfere with normal venous flow. So what the authors wanted to investigate was how any changes, or was there different changes in the veins of the cerebrospinal veins that go up to the head or come down from the head, and seeing if there was maybe some sort of blockage there that's caused by anatomical changes that can be contributed to with subluxation of the atlas vertebra. They say that these anomalies may cause alterations to blood flow and therefore result in iron deposition, specifically causing decreased brain metabolism and therefore the degeneration of the neurons that is characteristic of patterns found in MS. To sum up, the mechanism that we're looking at is that venous stasis, basically the reduction of flow or backing up of flow of drainage, it causes increased iron stores in the body. Specifically, the red blood cells that sit there are degraded by macrophages, and iron is converted into ferritin. The increased storage creates an initial chronic inflammatory signal response and brings T cells to the area. The inflammation found in MS is the exact type of T lymphocyte and macrophage invasion that is what is found in what we just described with venous stasis. Last week, we talked about how the blood-brain barrier can also be affected with whiplash and trauma. So this makes perfect sense. So these chiropractors looked at evaluating the upper cervical radiographs and chronic cerebrospinal venous insufficiency in individuals with MS and compared it to those without MS. It's a very small sample size. I believe they used 4 for the control group and 4 for the experimental group. So that's why it's a pilot study. So we wanted to see more. I don't know if they've done a follow-up since then. They used ultrasound for venous insufficiency, and they used upper cervical x-rays for the evaluation of atlas position. What they found was significant decreases in venous outflow in the MS group compared to the non-MS group. Specifically, stenosis of the jugular vein, venous reflux, compression blockages. They found kinking of the vertebral arteries in those MS that weren't present in those without MS. So what this is showing us is that there is an anatomical disadvantage, it seems, of those with MS. But does every person who has vertebral arteries and jugular veins have MS? Probably not. But they also found a pattern of individuals who were diagnosed of anterior protrusion of the atlas compared to the non-MS group, which led them to conclude that the relationship between atlas misalignment and chronic cerebrospinal venous insufficiency, when these two are connected, it relates to MS. They found a significant parameter of C1 misalignment in patients with MS and CCVSI versus controlled subjects. Because of the proximity of the atlas vertebra to the arteries of the veins of the head, these individuals need to get checked. Now, you don't need to go run off doing ultrasound of all of those veins, right? You don't need to go off even running upright MRIs. You don't need to do any of these things. All you need to do is make sure that you are specifically checking for the alignment. In this article, we're saying of the atlas, but yes, you should be doing the whole spine. You should not be flying sevening. You should not be popping and praying. You should not be moving a bunch of stuff and hoping for the best. You should actually be doing chiropractic, which involves analyzing for the presence of subluxation using whatever technique that you choose. Subluxation is more than joint dysfunction. It includes multiple other components. Specifically, the one that's most important to me is the nervous system, is the involvement of the nervous system. You need to be able to see that and document that and see that it changes. There are wonderful tools out there. You can use the Insight. You can use MyoVision. You can do a lot of things. You can use postural control. If you adjust the atlas and the entire body orients itself from the top down, you can pretty much see that if you have a global 3-dimensional postural change from adjusting the atlas, that you affected the nervous system, because it's the nervous system, specifically the vestibular nuclei, that control posture. So, MS or not, get them checked. Venous insufficiency or not, get them checked. Is this joint dysfunction? No, it's subluxation. Is the adjustment a spinal manipulation? No, it's an adjustment. So stop mixing it up. Stop calling that. Analyze specifically. Find out if it's present. Find out which way it has misaligned, because if the atlas is moved forward and to the left, and you move it backwards and to the left, you're not going to clear this out, and people are not going to get better. And then all of a sudden, people walk around saying chiropractic doesn't work. Chiropractic does work. It just needs to be done well. Never question the philosophy. Just question the intent and question the application. Hope you guys got to learn some more about this. I can't wait to be tagged in your MS videos talking about this concept, talking about the upper cervical subluxation and multiple sclerosis. Once again, this was called upper cervical vertebral subluxations in multiple sclerosis subjects with chronic cerebrospinal venous insufficiency. I'm Dr. Anthony Pellegrino from ChiroEdge. Post your Facebook videos and join us on our 30-day One Funnel Away challenge, where we get to dive in with Russell Brunson, looking at the different types of traffic to feed our funnels with, looking at marketing, looking at overall mindset, and looking at copy and understanding how to sell things online using different scripts that they have, etc. Anyway, I'm looking forward to having you guys join us on that at ChiroEdgeMedia.com/funnel. Thank you for listening. I love you, my little subluxation slayers. Go out there, slay some subluxation this week.